Hello, emergency room. Hey, I was wondering, can you get someone pregnant by dancing with them? No, sir, that is very unlikely. What if she wasn't wearing any underwear? Excuse me? She was giving me a lap dance and she wasn't wearing underwear and I finished. I reached completion. You understand? Yes, unfortunately, I do understand. Could that result in a pregnancy? Sir, look, I can't give you medical advice over the phone, but if you'd like to come in, I can get you a better answer. Will she need to come in too? If you can get her here, yes, that would be ideal. And since she's an adult, her mom won't find out, right? Why does it matter if her mom found out? Because her mom and I are married. Sir, are you saying that your daughter gave you a lap dance? Oh, dude, don't be disgusting, no. Oh, okay, good, because I was gonna say, she's my stepdaughter. What? It was at her 21st birthday party. Okay, sir, you're here for hemorrhoid pain. Hi, yes, that's me. It's starting to hurt really bad. Why are you standing like that? I didn't want to waste any time. Got it. When did the hemorrhoids start? This morning, right after I went to the bathroom. Any leaky discharge? Yes. Every time I touch it, there's a gross, smelly discharge on my fingers. Okay, and on a scale of 1 to 10, how bad is the pain? Oh no. What? Something's happening. I can feel it. You gotta get back there. Okay, don't move. Seriously, this is bad. Where is it? It's right there, to the left. Is this it? Yes, be gentle. Ow! Sir, this is a piece of poop. What? Yes, poop. See? Huh. That's weird. Sir, please pull up your pants. Any way to prevent this from happening again? Yes. I'm gonna prescribe you 30 cc's of wiping your ass. Alright, Anthony, I'm gonna start an IV on you. Why? Because the doctor ordered you some medication and I need to start an IV to give it to you. Okay, but please tell me everything you're gonna do before you do it. Of course. First thing I'm gonna do is tie this tourniquet around your arm to get a better look at your veins. Ow, that's really tight! It'll just be for a second. It's too tight, you need to loosen it! Okay, how's that? That's better. Okay, this is gonna be a little cold. I'm gonna clean the area. What's in that? It's just a little soap and disinfectant to clean the area before I put the IV in. Okay, fine. Here we go. Okay, here comes the needle. Big poke on 3. 1, 2, 3. Okay, all done. Is that it? Yep, just gotta flush it with a little saline and we can start your meds. Whoa. What's in that? Just some saline, a little salt and water. No, I can't have that. I'm not allowed to have salt. Oh, there's very little salt in here. It shouldn't affect you at all. No, my doctor says I can't have salt because my heart is weak. Plus, it makes my stomach hurt. I'm on a no-salt diet. It should be in my chart. Please read it. Anthony, this amount of salt should not affect your heart. If you push that into my veins, it will give me a heart attack. Are you trying to kill me, you dumb mother— 52-year-old male with chief complaint of 8 out of 10 chest pain that radiates to his abdomen. Upon attempt to place patient IV, patient states that he does not want IV to be flushed with normal saline because it contains salt, which will make his abdominal pain worse and give him a heart attack. Attempted to explain to patient that there is minimal salt in saline, to which patient replies, quote, "Are you trying to kill me, you dumb motherfucker?" End quote. And be notified. Ordered a flush with dextrose instead. Patient agrees. No further incident at this time. Help! I need someone to look at my dog. It's an emergency. Whoa, ma'am. This is an ER for humans. But he's acting weird. He won't make eye contact with me. Plus, I have gonorrhea. Oh, okay, we could check you for that. No, you don't understand. I'm here because I think I gave it to my dog. I'm sorry, you think you gave your dog gonorrhea? Yes! Did you and the dog— Ew, no, gross, not like that. Okay, then why would you think you gave your dog gonorrhea? Well, he has a habit of going through my dirty laundry hamper, and I found him licking one of my dirty underwears. Do you think it's possible that I gave him my gonorrhea that way? No. But he's acting so weird. He's licking his area more than usual. He won't cuddle. What if I've ruined him? What if he resents me for giving him an STI? Ma'am, listen to me. You did not give your dog an STI. How do you know? How did I know? Lucky guess. Turns out her dog was not a he. It was a she. And she was pregnant. That's why she was acting weird. Your dog cannot get an STI from licking your dirty STI-infested underwear. Thank you. Come on, honey, just one more push. My baby girl is almost here. You mean my baby girl? I said what I said, and it's about the last thing you're ever gonna say. Hey, no fighting in my delivery room. Honey, you're doing so well. Unlike this Neanderthal, I would never teach my baby violence. Well, unlike this weakling, I'm gonna teach my baby how to defend herself. My baby won't have to defend herself because I'm gonna defend her with my life. I brought my baby a Build-A-Bear. I brought my baby a bigger bear. I brought my baby a real bear. Woo! Here she comes, one more push. Congratulations! Ooh, don't be mad. Healthy baby girl born 7 pounds, 6 ounces, vital signs within normal limits. Baby's father was not present for the birth. Mother and 2 male companions present. Mother and 2 male ex-companions present.
What's going on today, sir? My dad had knee surgery last week, and now he can't stop peeing. Not to worry, we'll get him checked out. Any pain in his knee? No. Anything else besides the frequent peeing? No. We will need a urine sample from him. I knew you'd say that, so I brought it. Brought what? His urine. Here. It's still warm. Oh. Wow. Okay, give me a second. Do you think it could be a UTI? We'll know more once we get this to the lab. I'll be back. Ugh. Okay, sir, what are you doing? Oh. Is it okay if I use this?
76-year-old male brought in by son for frequent urination and past medical history of the left knee surgery. Upon initial assessment, patient's son provides a urine sample in a container that he collected from home. After urine was sent to the lab, patient's son was seen washing the container using the sink in patient's room. Advised patient's son against reusing containers with urine in it, to which son replies, quote, "Why would I throw away a perfectly good container?" End quote. MD notified. Social work consult requested. No further incident at this time.
What the fuck?
Ambulance is here! What do you got? Ooh, what happened to that guy? NBA versus Pole. Guy took his wife's Porsche to go visit his mistress, crashed it on the way home. Talk about karma. Yeah, wait till the wife finds out.
There you are, you son of a bitch!
Uh-oh.
You're cheating on me and you crashed my car?
Honey, please, not now. I'm in pain.
How long has this been going on?
Hey, guys, can we keep it down? There's other patients here.
You lied to me, Brian!
Oh, we sure did. The pain's too much. I don't even remember what happened.
You don't remember? You don't remember? I'll help you remember. Ah! Take that back to your girlfriend, you little
48-year-old male MVA versus Pole with chief complaint of fractured left femur and multiple hematomas. Upon returning from CT, patient's wife arrived and violently rips out patient's Foley tube as if she was trying to start a lawnmower. MD notified. Police report submitted. Surgery consult for reconstructive surgery in progress. Success seems unlikely. We'll continue to monitor.
Little Tommy here is 8 years old, has not pooped in 3 days. It's okay, sweetie. Mommy's here. So, Mom, we're gonna do a disimpaction. What that means is that we're gonna go in and manually scoop out some of the poop that's stuck inside Tommy. I understand. Please do what you have to. Okay, Tommy, go ahead, turn to your side and face the railing. Here we go. Hey, what is that? Is that a string? Do I pull it? Well, you're certainly not gonna leave it there. Is that a tampon? Oh my god, that's a tampon. What do we do? I don't know. Have you ever seen a tampon come out of someone's butt? Is everything okay? Everything's fine, Mom. Should I call the social worker? You think this is abuse? I don't know. She wouldn't have brought him here if she put it up there. Well, then let's just go ask her. Fine. Ma'am, do you know what this is? Oh my god, is that a tampon? Yes, it's a tampon, and we found it inside Tommy. Mom, do you have any idea how that got there? Of course not! Sweetie, why do you have a tampon inside of you? I saw Amy do it. Who's Amy? His older sister. Sweetie, what do you mean? I saw Amy take one, put it down there, so I did too. Oh, honey, no. That's just for girls. We'll give you 2 a minute. I'll call the social worker.
Hi, I'm taking care of this patient, and he stopped breathing. Who are you on the phone with? 911. Hit the blue button! The ER can be a bit overwhelming for new nurses. What are you doing?
ChatGPT says compressions need to be at least 2 inches to effectively squeeze the heart and circulate blood throughout the body. Don't get the crash cart!
It just takes time to adapt to the speed of the ER. What is that? You said get the trash cart. I said crash cart. Why would I need a trash cart? I don't know. For the body? It's not for everybody.
He's in VFib, get ready to shock. Charging. Okay, let me know what. Ah! My bad. We did manage to get the patient back. Says here code status dinner. Luckily we got him back in time for dinner. DNR.
Hello, how can I help you? I need you to test this. What is that? It's my boyfriend's pubes on a towel. Ew! Oh my god! I almost touched that with my mouth! I need a paternity test to see if he's the father. We don't do that here. This is an ER. Well then, can't you send it somewhere? This is a hospital. No. I need to know if he's the father. Why wouldn't your boyfriend be the father? Because I'm sleeping with another man and I don't know who got me pregnant. Ma'am, like I said, this is an ER. We don't do. Are you really gonna deny a pregnant woman? No. Of course not. Let me just put this glove on, and I'll take that from you. Hey, Austin, catch! What is this? Some dude's pubes on a towel. Oh, gross! Rich! Okay, all done. Test determined, he is the father. But how? You didn't even get my DNA, or the baby's. Oh. Right. If you aren't gonna test it, I want that hair back, and I'll go to the hospital down the street. Well, I am not leaving until I get that hair back. Of course. Let me just put some gloves on. I'll be right back. Austin, where'd you put that towel? I burned it, Rich. Go away. Ugh. Fine. Ah! Oh. Okay. Here you go, ma'am. I found it. Finally. Useless. I'll find out who the father is myself. Good luck with that. Next! Hey, Mr. McDonald. Hope you're still doing okay. I have a new nurse here. This is Rena. Is it okay if she takes over your evaluation? Of course! How's it going, Rena? Hi. So, Mr. McDonald, as you know, you've been exposed to a potentially rabid cow. That's right. And you'll need the rabies vaccine to prevent infection. That's what they tell me. It'll be a series of injections depending on weight. Not a problem. 350 pounds. Oh no, I need your weight, not the cow's. 350 is my weight. Oh. Okay, thanks. We'll be right back. Welcome to the ER, ma'am. How can I help you? It's my son. He developed a rash today. Well, it doesn't look like he's having any trouble breathing, so that's good. I'm just so worried. He's never had anything like this before. Does he have any allergies that you know of? No. Any new pets or animals that he's been around? No. Have you been using any new soaps? No. When did you notice the rash? Right around this morning, after breakfast. And what did he have for breakfast? Some blueberry waffles. 6 to be exact. Has he ever had blueberry waffles before? No. Never. He might be allergic to blueberries. But that's not possible. His rash isn't blue. Right? Let's just get you guys back. We'll figure it out. Welcome to the ER. How can I help you? My knees are killing me. Oh wow, they're really swollen. When did this happen? 4 days ago? It's starting to get hard to walk today. I'll get you a wheelchair. Any past medical history, surgeries, or allergies? Just diabetes. And I'm lactose intolerant, which is why I think this is happening. Why would that have anything to do with your knees? Well, I wanted my bones to grow stronger, and I've always wanted to be a little taller, you know? And? So I started using my insulin needles to inject low-fat milk into my knees. Low-fat milk? Why? You think I should have done whole-fat milk? No! No milk! Why would you put milk in your knees? Who told you to do that? It's supposed to be good for your bones. When you drink it, your knees are clearly infected. We have to drain them before you develop septic arthritis. No, don't drain them. The only reason this is happening is because I'm lactose intolerant. What do you expect us to do then? Just give me something for the lactose intolerance and leave the milk in there. Please. I have a date this weekend, and on my dating profile, I put that I was 2 inches taller than I really am. I'm hoping the milk kicks in by then. I worked as a forensic nurse and had to complete a suspect exam on a very tall man accompanied by 3 police officers. A suspect exam is when a nurse will come in to gather evidence that may or may not link a patient to a crime. In this case, likely a sexual assault crime. One officer told me he is feisty.
I explained the exam, and when I showed him the very large swab I was going to use to test for STIs, he yelled, "Nah, you ain't!" So I said, "This is nothing. Wait until I have to pluck out those pubic hairs." He then attempted to get out of the room and was tackled by police officers, held down, while I happily plucked 25 pubic hairs while humming the song from Bad Boys. 25 pubes is oddly specific. Like, is that the recommended quota by forensic nurses? If you want 26, do you need a warrant? Honestly, the real crime was how happy she was doing it. 5 pubes, that's data. 25 pubes, that's personal. She didn't just do her job, she was a pluck above the rest. Okay, sir, you're having numbness from the waist down?
Yeah, like, sometimes I could feel my legs, and sometimes I can't. It's kind of hard to explain.
How long has this been going on for?
Oh, well, maybe...
He's been ignoring it for 2 months now.
And you are?
Oh, I'm his wife, darling. Who else would be in here in the middle of the night with him?
I see. Sir, you're also having random falls because of the numbness?
Yes, like Toy Story.
I'm not following.
You know, Andy's coming! And everyone just drops like a lifeless toy. That's how he falls. I call it Andy's coming home syndrome, the way he just falls like those toys.
Sir, is that an accurate description?
Well, to be honest with you, I ain't never seen Toy Story, so...
You've never seen Toy Story? I'm sorry. Please continue.
Yeah, that's an accurate description.
Okay, and how are your erections?
Oh, those haven't existed in years. I call that Andy's home, and he never left. He's a shut-in.
Yeah, that's correct.
Well, I'm gonna go let the doctor know what's going on. In the meantime, we do have a monitor here. You can watch a movie. We do have Disney Plus if you're interested in, researching your case further. Is anyone gonna come send me on break?
Code Blue, OR, Room 3, Code...
What the hell is going on? Steve, help! Who is on the OR table? It's Lexi. Lexi who? Nurse Lexi. She was supposed to send me on break 20 minutes ago. Why is she unconscious? And why is your pants down? We were having sex and things got escalated. What does that mean? She asked for lube and I grabbed this jelly. You grabbed lidocaine jelly? I didn't know it had lidocaine in it when I grabbed it. You used an anesthetic as vaginal lube and anal lube. Oh my god. She said she wanted to try something new. Paralyzing her colon from the inside out is definitely something new. Will you just make sure she's breathing? I can't feel my pee. I'm supposed to be on break. Lexi, wake up. 26-year-old female found unresponsive after MD Kevin allegedly used lidocaine jelly during an unsanctioned sexual encounter in unused OR. Do you really have to use my name? How's your BB? Still numb. Serves you right. Congratulations on the new baby.
Thank you.
Dad, were you able to fill out that paperwork? Yeah, why do I have to fill this out again?
Oh, it's just to say that you are the legal father of the child.
You don't think I'm the father of the child? No, I didn't say that. It's just, we have everyone do it. I didn't see you make her do it. You mean the woman who just gave birth to the baby? Yeah. How come she doesn't have to sign anything that says she's the mother of the baby? Well, I'd say because pushing a baby out of your uterus in a room full of people is all the proof we need. Are you giving me attitude right now? Because I'm not having this. So the only thing you're not gonna have is custody of this child if you don't sign those papers. Let me get this straight. You're saying that I have to sign this paper to say I'm the legal father of this child. Yes. And you're saying that she doesn't have to sign any papers to be the legal mother of this child. Correct. And your reasoning behind that is because you saw her give birth? Yes. Exactly. Anyone could be the father of this child, only she could be the mother. That's why we need you to sign these papers. But how does that make sense to anybody? You know what? You're right. Maybe it's best you don't sign this. For the baby's sake. 54-year-old male, chief complaint, urinary retention. We got an order for an x-ray, foreign body object, and pelvis. You think he stuck something up there? Doctor thinks it's a BB pellet. I'm gonna say spaghetti noodle. Ooh, okay, put me down for a pipe cleaner. You got it. Huh. I don't see anything. Maybe he already passed it. Oh wait, is that a pyramid? Is that the tip of a Bic pen? Sir, did you put a pen in your urethra? Yeah, isn't that clear from the x-ray? Why? I had to pee and nothing was coming out. You punctured your bladder. You know, they actually designed the Bic pen so you could write underwater, even in outer space. Now is not the time, Alan. Hey, that's a pretty interesting fact. Not another word out of you. I'm calling the OR.
Sharon, you really shouldn't be working so hard after giving birth. I have people who rely on me. Well, I'm gonna take your little one to the nursery. We'll be back in a few hours so you can breastfeed. They said the baby is perfectly healthy, right? Baby's perfectly healthy. See? Told you. Okay, Sharon, ready to feed your... Hey, have you seen my patient who just gave birth?
No, is everything okay?
Can't find her anywhere. It's time to feed her baby.
How long has she been missing?
3 hours? 3 hours? Why didn't you say something earlier? I thought she was just walking around working. I was waiting for her to come back.
For 3 hours?
I know! Help me! Have you told security yet? They can't find her either. Do you think something happened to her? I don't know. Does she have an IV?
Oh my god.
She does!
Any history of drug use?
I don't know! Am I gonna lose my license?
Okay, just calm down. Try her emergency contact number. Maybe she's with them.
Okay. Hello? Hi, I'm looking for Sharon. Speaking. Oh my god, Sharon, where have you been? We've been looking all over the hospital for you. Oh, I had my friend come pick me up. I had to go home to see my baby.
You have other kids?
Oh no, Mr. Snuggleton, my cat. It's almost time for him to eat. Yes, it is.
Okay, but what about your actual baby? It's her feeding time too.
Oh, right. Can you just give her a little Jell-O? No red though. I heard the red dyes are bad for kids.
I would give her formula.
Perfect. I'll be back soon.
No, Sharon, you need to get back here right now. You still have an IV in your arm.
Oh, this thing? I'll just pull it out.
No, Sharon, do not pull out your IV.
Done. Oh my, that's a lot of blood.
Are you freaking kidding me? Dave, tell me again, what brought you into the ER?
How many times do I have to say this? My pee hole got glued shut and a tiny champagne bottle got stuck up me bum.
Dave, my poor baby.
Right, but how did this happen?
Well, I was bored last night and I invited Dave over for some drinks and some playtime. And ever since the wedding, he's been really stressed out.
Oh, you two are married.
Is that any of your concern?
My apologies. Please continue.
And I know Dave really wanted to get away from his wife.
You're married to a woman.
Can you please just let him finish?
My apologies. Please.
And my boyfriend, Ricky, he was also out of town.
Oh, you have a boyfriend.
Do you want to hear the story or not?
I mean, more than anything.
So we start hooking up and it's all hot and then we hear this noise downstairs.
No way.
Yeah, and it's Ricky. He like forgot something.
And then what happened?
And then he sees us, he sees the drinks, the crafts, and us butt naked, and he flips out, and then he tackles Dave right to the ground.
And that's when you glued your pee hole shut?
And stuck a champagne bottle up me bum.
I see.
But listen, man, please don't let my wife find out about this.
Oh, well, here's the thing. She was your emergency contact.
Oh no.
What the? This day can't get any better.
Hey, I'm looking for Dave.
Ricky!
Ricky? Oh no!
Never mind. It just did. You're a dead man.
Where is the OB? She just DM'd me. She's stuck in traffic. Okay, Miss Garcia, you need to push. Push! Betty, you can't just say that to Miss Garcia. She doesn't speak English. Oh my god. Miss Garcia, I am so sorry. I am so lo siento.
Wow. You're like fluent.
I am. She had a 4-day Duolingo streak last month. Yes, she did. We need someone who speaks Spanish. Okay, wait. When I was in Cancun, I was trying to open this door, and this really nice man said puta to me because it was a push door.
Puta. Okay, that sounds like push.
It does.
Miss Garcia.
Puta. Puta, Miss Garcia. Puta. 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 Puta.
Breaking news. Maria Garcia, a new mother, is suing the hospital where she gave birth for racial discrimination after repeatedly being called in Spanish. The two nurses have been placed on temporary leave as the hospital investigates the situation.
Sir, you need to poop. It's been almost 3 days. You think I don't know that? I've tried everything. Laxatives, prunes, reading, walking, calling my mom.
Your mom?
I was desperate. It didn't work.
Well, we've got to figure out something.
Maybe it'll help if you stay in the room while I try to go.
Or maybe just call your mom again. Okay, I'm just gonna give you some privacy.
Wait, stay. I think you being here is helping.
Really? Because it's hurting me.
Seriously, it's working. The closer you get, the closer I get. It's almost there. I can feel it. Oh no.
What?
I think it's stuck. Quick, hold my hand. It'll help me go.
What? Ew, no. What do I look like, a human laxative?
Come on, man, hold it. Stop being such a bad nurse.
No, hold your own hand.
Ugh, fine. I don't need you. I'll do it myself.
No, what are you doing?
What does that look like? I'm getting myself unstuck. Just gotta get it at the right angle. Ah! Oh! Oh! Wow. Wow.
feel so much better.
That makes one of us.
Excuse me.
Yes? Aren't you gonna help me wash my hands? No, something tells me you could do that yourself too. Man, the service here is shit. Got here as fast as I could. Where's the emergency?
The baby's crying again.
Okay. And what would you like me to do about that? Make it stop? The sound's getting pretty annoying. Okay, so that's a baby? Crying is kind of his whole thing.
Well, his thing is giving me a migraine.
Yeah, can't you work your magic or, whatever?
That's what you do, right?
Not exactly.
Thanks, you're a lifesaver.
Also, diaper's full. Of course it is. Anything else I can do for you guys while I'm here? Maybe file your taxes?
Oh no, we did that already. We're responsible.
Right. Just not with your baby. Oh no, we're great with kids. Just, not this part. You mean the parenting part?
Exactly. Ugh, it's the crying, the feeding, the holding,
The sleeping, the waking up, the diapers.
the whining, the burping, the spitting.
So, the baby. Pretty much.
But he'll grow out of it. At least that's what happened to our other ones.
I'm sorry, your other ones? What, you thought this was our first kid? No, this one's our third.
We're pretty much pros at this point.
Uh-huh. Where exactly are your other two kids right now? Oh, they're right over... Well, they're just here somewhere. Fantastic. 2 missing kids, 1 dirty diaper.
Hey, while you're holding him, can you make sure he's eaten? I think he might be hungry.
Huh, yeah, sure. Why don't I just breastfeed him for you while I'm here?
That'd be great. You're the best.
Blink twice if you want me to call Child Protective Services. Has anybody heard from the resident on call?
Nope, nada.
Not I. Ah. Hello? Hello, is this the resident on call?
Yes?
I put 2 calls out to you already.
I'm sorry.
We have a patient here with a blood pressure of 170 over 89.
Oh no.
Yeah, earlier it was in the 150s.
Oh no.
Is everything okay?
Yes, everything's fine. Does the patient have...
No headache, chest pain, dizziness, confusion. Patient is asymptomatic.
Let's get them on metoprolol with a stat dose now.
Okay. How much? Doctor?
5 milligrams. Let's start with 5 milligrams now.
Okay, look. The lowest dose of metoprolol we usually give is 12.5 milligrams.
Shit. God, so stupid.
Is this your first shift?
Yeah, it's my first solo shift.
Oh, okay. I see. Alright, look, I'm not a doctor, but if I were, I'd consider metoprolol, 12.5 milligrams, twice a day, first dose now.
Okay, sounds good.
What does?
Metoprolol, 12.5 milligrams, twice a day, first dose now.
Is that in order?
Yes?
Great. Thank you, doctor. Do you need me to tell you how to enter it?
Yes, please.
Okay, first thing, turn on your computer. Okay, sir, you're here for buttock pit.
Hi, yes, that's me.
Let me guess. Broomstick?
Actually, it's a sledgehammer. Oh,
You took the head of the hammer off first, of course.
no. It's in my butt.
I beg your pardon?
Hammer side in.
Sir, why would you...
I lost the bet.
Huh, it's not all you lost.
I'll say, I almost got lost driving here.
How did you manage to drive here?
Very carefully.
That somehow makes it even more confusing. Hey, I'm gonna need a portable x-ray, surgery consult, and a very brave intern. 2 very brave interns.
You can't touch this.
Your wife is doing so well today, Gary. Her vitals are stable, no skin breakdown. I think this is the most peaceful I've ever seen her.
Oh, I think I know why.
Really? Why do you think... What is that?
That's mine.
Your what?
My hair.
A hair from where?
My belly.
Why is it on the rail?
When Maisie and I used to lay on the couch at night, she would always put her hand on my belly. I think it made her feel safe and at home. So you brought a piece of home here, and it's helping, isn't it, Maisie?
Sir, I don't think it is.
You said her vitals were stable today.
Yes, but...
That means she could feel me. Gary's here, honey! Can you please make sure to lift her hand every few hours so she could touch my hair?
Oh, sir, I'm not touching that. Most families just bring in a picture, some flowers, or a favorite scent.
But this is a good idea too, right?
Well, you can't argue with the results. She is stable.
Okay, sir, I see you're here worried about an STI.
Yes, I caught my girlfriend cheating on me.
Are you having any symptoms?
How could she do this to me?
Sir, are you having any symptoms?
No, but I should get checked just in case, right?
Yes, of course. The doctor ordered a urethral swab.
What's that?
We insert a swab into your urethra to collect a sample.
Oh, yeah, no, right, of course.
You understand what a urethra is?
Hey man, you sound just like my girlfriend, always calling me an idiot. Of course I know what Aretha is.
No, not Aretha like Aretha Franklin. Urethra.
Are you calling me stupid?
No, not at all. I think you got it. Go ahead and pull your pants down and your underwear and we'll get started, okay?
Oh, hell no! You're not sticking that in there, man! You're crazy!
Sir, you left your pants! You could have at least given me some respect.
R-E-S-P-C-T, find out what it means to me.
How are the contractions, Lisa? Every 3 to 4 minutes now. I think we're getting close. I take it the nipple stimulation worked then? Worked like a charm. We always knew we wanted to do this naturally. I love how in sync you two are. I could tell you guys make a great team. I know. I'm so lucky. He's been so supportive of me since day one. And I'm sure you knew shortly after, he'd be the one. The what? The father of your children. Oh no, I'm not the father. Just the nipple stimulator for today. Oh, my apologies. Stepdad? Oh no, I'm her brother. Her what? He's my brother. He's been with me since day one. Oh, you meant like literally your day one. Oh. Hi, wifey. Hi, my love. Thanks for your help, man. Anytime. Okay, please tell me you're the father. Yes, I am. You're not gonna tell anyone about this, are you? Of course not. I am bound by Nippa. I mean, HIPAA.
আমি চাইনি তোমার মন খারাপ হোক।
এইটা এখন আমাকে বিশ্বাস করতে হবে। তোমার ভাইয়ের যে একটা বন্ধু আছে না অয়ন ভাই, উনি অনেক চালাক আছে, অনেক স্মার্ট। এই আপু 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 শুনো শুনো শুনো, তুমি রাগ করলা?
তুমি যদি একটু পড়ো।
আপনাকে ঈদের শুভেচ্ছা।
ধন্যবাদ।
টপো দাঁড়া।
মেয়েটা দেখছিস?
কোন মেয়েটা?
তোদের বাসার দোতলায় আসছে।
মা, মোম দিয়ে যাও না। আরে আসতেছি রে বাবা। আপনার গান শুনে ছাদে আসলাম। আপনি গিটার বাজান বল।
কি দিল এটা? 100 টাকা? আমি তো চাইছিলাম তোর মন খারাপ এটা। তুই কি আসার আগেই জানতুই না আসার পর জানছস?
সাদা ওড়না, কপালে ছোট্ট একটা টিপ, রোদের আলো।
এদিকে আয়, তুই আয়। আরে
আজ বেলাতে তোমার সুরে সুরে।
এই বিকেলে মাঠে আসবি তো? ফয়সাল আসছিল, ঈদের পরে কক্সবাজার যাওয়ার প্ল্যান করতেছে।
তোমাদেরকে আমার পরিচয় মানুষ চিনে, তোমাকে চেনে, ইউ আর দ্য ফাদার অফ ম্যাক্স দ্য প্র্যাঙ্কস্টার, ঠিক আছে? তোমাকেও মা
বিরাট স্টার।
বাট আমি চাইবো আমার ফার্স্ট মিটিংটা অনেক গ্লোরিয়াস হোক। আর যদি সে ফ্রড হয় তাহলে কিন্তু ওর খবরই আছে, একদম থাপড়ায় সব দাঁত ফেলে দিব। যাই হোক, দেখা যাক কি হয়। আমার লেট হচ্ছে দোস্ত, রাখি। হ্যাঁ,
টিন্ডার থেকে তুমি এর আগে আর কারোর সাথে কফি ডেট করেছো আমি ছাড়া?
হোয়াট? আমাকে কি দেখে মনে হয় চিপ? আমি এক্সক্লুসিভ ভার্সন, ওকে? আই এম নট অ্যাভেলেবল। কি ছিল? কি ছিল?
প্র্যাঙ্ক ছিল, বিশেষ হচ্ছে না। এই যে
Prank
আই সুইট, আই সুইট, ওই যে দেখেন মনোপড নিয়ে দাঁড়ায় আছে। এই যে আরেকজন ইফতে, একদম একদম গুলি করে দিব মাথার মধ্যে, ফুটা করে একদম এদিক দিয়ে বাইর করে ফেলবো। কি আছে বাইর কর?
কিচ্ছু নেই।
দে দে, হাত কিলু কেলি দে 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 দে। দেখি দে।
হ্যাঁ দোস্ত, ওই ওই যে প্র্যাঙ্ক বা ওই যে কি জানি একটা ছেলে আছে না ফালতু, সারাক্ষণ মানুষকে ধোকা দিয়ে বেড়ায়, ওকে চিনিস তুই?
হ্যাঁ চিনবো না কেন, ওকে না চিনার কি আছে, ওকে চিনে না এমন কেউ আছে?
এই শিখেছি তোরে 50 কি টেলিলেন্স নাকি? হ্যাঁ 85 ইউজ করবি, দরকার পড়লে তোর আমি 70-200 কিনা দিব।
তুই টেনশন করিস না। হ্যাঁ
কোনো চোর না, চুরি না, ডাকাতি না, এটা প্র্যাঙ্ক ছিল, টোটালি প্র্যাঙ্ক। প্র্যাঙ্ক শিখাইছে উস্তাদ। কেমন হলো প্র্যাঙ্ক? এটা সত্যি সত্যি প্র্যাঙ্ক ছিল, আমি ক্ষমা চাচ্ছি, সত্যি সত্যি প্র্যাঙ্ক ছিল। এ ভাই দেখেন দেখেন দেখেন, কালোই তো করবো। আরে আপা আপনি তো এমনিতেই সুন্দর।
বাবাকে সালাম কর, আরেকবার সালাম কর। মা, আমার বিয়ে করা বউ তোমাদের বৌমা।
আমি আসছি তো, আমি সব ঠিক করে ফেলবো। তুমি বসো, বসো তো, এখানে বসো, আমি দেখছি। আন্টি, আঙ্কেল,
ফাইনাল ডিসিশন লয়ে লইছি, আজকে রাতে কিন্তু আপনার লগেই ঘুমাবো।
আমার লগে কেন বাজান? আপনি আমার লগে ঘুমাইবেন কেন?
জিন্দেগি তুই এইটা আর পোষাইতে পারবি না বাজার। তোর আমি সাজিয়ে দিতাছি তুই জলদি
ক্যাচে লাগাইছে।
মা তুই এক কাম কর, জামাই লইয়া শ্বশুর বাড়ি জাগা। বোন মা শ্বশুর
এই তো একেবারে বাঘের বাচ্চা।
ফুদি দে।
আচ্ছা বাঘের মতন যাবি?
আমি কইতাছি ওখানে খুইলা আসো, নাহলে আমি টাইনা ছিড়া ফেলামু কইলাম।
আমার খানদানি পোশাক তুমি তাই না ছিঁড়া ফেলাইবা?
আমার ফোন দাও।
নিবারা আমারে কইছো বন্ধুর লগে কথা কও, তুমি তো এঞ্জেল সোনিয়ার লগে কথা কও কি?
তারপর বউরে দিয়া হাত পাটি পাইছে, এর বাদে বউরে কইছে পানি লয়ে আহো, বউ পানি লয়ে আইছে, এই পানি দিচ্ছে ফালায়া।
আম্মা, আব্বা, রুডি সুরত দেখছেন? রুডি এরকম তেরে বাগা খেলা, হ্যাঁ? রুডি সুন্দর। আব্বা আমারে না হয় তুমি বুঝাইলা, তুমি তোমার খানদানের কি বুঝাইবা, আমার আত্মীয় স্বজনের কি বুঝাইবা?
আমি দুঃখিত।
বইয়ের হাতে মার খাওয়া চলে, তাই কিছু কই নাই কা।
আমাগোর খানদানে জামাই মারনের নিয়ম নাই কা।
তুই আমার এখান থেকে যাবি না মানে কি? অক্ষণ তুই বেরোবি।
আব্বা
কইলজা কাঁপে না?
ওই বেটা ওই, তোর কইলজা কাঁপে না মিছা কথা কইতে? হ্যাঁ হারাম খোর জানি কোনখানকার।
মাগার মারামারিতে 1 নম্বর।
আমি পারি, এখন মনটা চাইতেছে তোমার কান্দের উপর চড়ায় একটা আসান মারি।
ঠিক আছে ভাই, তাহলে আমার মুখ চুপ বন্ধ থাকবো, আর কেউ আমি কিছু কমু না, মুখে কষ্ট।
এখন লাইনে আইছস।